CCA Exam 2026 Medical Coding Practice Test and Study Guide, 25 Challenging Questions. Question 1. In ICD-10-CM, a placeholder X is used for unknown diagnoses, future expansion, and to keep a code valid at 6 or 7 characters, excluding a code. Patient refusal. The X allows for additions while maintaining the specific code structure. Question 2. Which of the following is an example of an evaluation and management E/M service? An MRI of the head, an office visit with a primary care physician, a surgical biopsy, a blood draw. E/M codes describe the cognitive work of a provider. Question 3. What is the CPT code for a standard appendectomy? 44,950, 10,060, 99,213, 70,450. The 40,000 series covers digestive system procedures like appendectomies. Question 4. Which domain of the CCA exam covers compliance? Domain 1, Domain 2, Domain 3, Domain 4. Domain 4 focuses on legal and regulatory compliance. Question 5. What is the principal procedure in an inpatient setting? The longest procedure performed. The procedure performed for definitive treatment of the principal diagnosis. The first procedure listed. The least expensive procedure. It is closely linked to the reason for admission. Question 6. Which organization publishes the ICD-10-CM official guidelines for coding and reporting? AMA, AAPC, CMS and NCHS, the World Health Organization. CMS and NCHS, CDC, provide the official U.S. guidelines. Question 7. What is upcoding? Using a higher level code than supported by documentation to increase reimbursement. Updating a code to a newer version. Coding for a patient who is upstairs. Entering codes into the computer. Upcoding is a form of fraud/abuse. Question 8. Which form is used for professional, physician, billing? UB04, CMS 1500, DA Form 200, W2. Physicians use the CMS 1500, hospitals use the UB04. Question 9. What does HCPCS stand for? Health Insurance Portability and Accountability Act, Hospital Information Privacy and Access Agency, Healthcare Improvement and Patient Assessment Act, High Impact Patient Care Association. HCPCS protects patient privacy and data security. Question 10. In CPT coding, what is a global period? The time it takes to travel to a patient. The period of time during which all routine care related to a surgery is included in the surgical fee. The expiration date of a code. The time between insurance enrollments. It includes pre-op, intra-op, and post-op care. Question 11. What is a modifier in medical coding? A change to the diagnosis. A 2-digit addition to a CPT code to provide extra information. A new code book. The person who corrects mistakes. Modifiers explain special circumstances, example, bilateral, discontinued. Question 12. Which of the following is a Z code used for an ICD-10-CM? External causes of injury. Factors influencing health status and contact with health services. Congenital malformations. Neoplasms. Z codes are used for encounters like checkups or family history. Question 13. What is the purpose of the National Correct Coding Initiative (NCCI)? To make coding more difficult. To prevent improper payment when incorrect code combinations are reported. To increase hospital revenue. To train new coders. NCCI edits identify codes that should not be billed together. Question 14. What does unbundling mean? Combining several codes into one. Separating components of a procedure and coding them individually when one comprehensive code exists. Sending a bill to the patient. Sorting paper records. Unbundling is an improper billing practice. Question 15. Which department typically handles release of information? ROI. Nursing. HIM. Health Information Management. Finance. Radiology. HIM ensures legal compliance when sharing records. Question 16. What is the APC system used for? Inpatient reimbursement, outpatient prospective payment, home health billing, pharmacy pricing. Ambulatory payment classifications are for outpatient services. Question 17. Which CPT section includes codes for X-rays and ultrasounds? Evaluation and management, surgery, radiology, pathology. The 70,000 series is for radiology. Question 18. Documentation of WBC 12.0, RBC 4.65 would be found in which report? Radiology report, pathology report, laboratory report, physical exam. Blood counts are lab results. Question 19. What does the acronym SOAP represent in medical documentation? Subjective, objective, assessment, plan, surgical, orthopedic, anatomy, physiology, safety, operations, administration, privacy, sodium, oxygen, acid, potassium. SOAP is the standard format for progress notes. Question 20. Which of the following is a covered entity under HCPCA? A patient, a healthcare clearinghouse, a pharmaceutical sales rep, an employer. Covered entities include providers, health plans, and clearinghouses.